I'm Dr. Jeff Brown with the Merge Medical Podcast with my very talented co-host, Dr. Jeff Cole. We're joined today by the CEO and founder of Medsender, Salman Haque. Medsender is a service as a software platform that uses artificial intelligence to automate what would otherwise be mundane and redundant tasks to free personnel to do other things. It integrates with multiple EMRs and works in any healthcare organization. That pretty good summary, Salman?
Yeah, absolutely.
Tell us about it.
Yeah, so I can give you the first place we started was actually somewhat interesting. We started out as a fax replacement software for healthcare. And a lot of what we do revolves around making fax easier for healthcare. And as physicians, faxing is still a really big problem in all types of healthcare settings. The vast majority of medical records are shared over fax. But what we realized as we built out our fax software platform is that it's not just that sharing records is difficult and often has to go over fax. It's that data is siloed in different systems and locations and companies and organizations. And what you have to have happen is a lot of manual work needs to go into both getting that data out and on the receiving side, when you're getting, say, a fax or a document, dealing with that. And that's where a lot of the administrative bottlenecks pile up.
So I read through some of the materials. A lot of that has to do with old-fashioned faxing. Can you tell me how you're moving from the 1970s, 80s technology to the world of AI? How does that all clash or come together?
Absolutely. So our platform started as a fax replacement platform, but what we realized is that fax presents the perfect way to insert automation into a lot of the routine workflows in healthcare. So what we do is we not only digitize that fax, but we also run it through AI models and tools we've developed to extract the relevant data, categorize, sort, and tag or assign things to the appropriate staff person. And we integrate with EMRs so that a lot of that manual processing is already taken care of. So by the time it reaches the relevant party, you've cut down on a lot of those extra steps.
And how much does this reduce your office staff workflow?
It really depends on the practice, but we've had practices tell us that, they've been able to avoid having to hire extra staff to deal with fax. Or for smaller practices, they're able to get by with the same staff, even if they get busier, or the staff can spend more time on more important things like assisting with patients.
And as far as need, I'm in a practice. It's 3 divisions merged to roughly just under 40 people. We use one of the larger EMR companies, popular solution, yet their fax module is average at best. So with that said, how do you feel the need is in the general market?
We see that there's a really strong need, and that's evidenced by our traction thus far. We're a really small team, and we've seen an enormous demand for this type of solution across the board, even with EMRs that do have a built-in fax module like yours, because it's not enough just to get a fax into the platform. What we found is that there's a real need and appetite for automating that process as much as possible, which we are now able to do with AI. It's not something that may have been possible 10 years ago, but certainly today we're able to help take that process and make it from a manual process into an automated one.
And do you have any competitors?
So there are a number of fax platforms out there, the vast majority of which don't offer any sort of AI. We think we have an advantage with our proprietary AI models, as well as with our integrations we developed with a number of EHR platforms.
What are your targeted markets? I know physician and provider groups, but beyond that, what are the other potential targets?
Yeah, so right now we're really focused on physician provider groups of all sizes. Historically, we've really focused on smaller ones because they do just have a really acute pain point there. We're working our way to larger and larger groups as well. But we also see a real need from other types of entities in healthcare, whether that's labs, radiology and diagnostic centers, pharmacies as well. Anyone who's sending and receiving medical records, especially over fax, could be a good target for us. And we do also have an API product that's geared for enterprises. So, we think there are a lot of companies that may want to integrate some of the Medsender technology into their own apps, whether that's a digital health company like a remote patient monitoring company, or an EHR, EMR vendor themselves that wants to bolster what their fax offering is. those are all potential customers of Medsender.
Are you seeing referrals from these channel partners?
We do. We actually partner with a few EHRs, and these EHRs are platforms that we integrate really well with and offer additional functionality for. And so if these EHRs have any customers that have faxing as one of their pain points or challenges, and we can be a solution for them, maybe above and beyond what the built-in offering looks like. Or in the case of an EHR that may not have a built-in offering, Medsender mitigates the need for them to have to build all of this out themselves in some form. And we've talked to EMR platforms that say we can build out a fax module, but it'll be simpler. It won't be as advanced as Medsender's, and it's work that they would be doing that takes away from other priorities for them.
What do you think the total addressable market is approximately?
Yeah, we think the market is quite large here. In terms of healthcare administration, when you break that sort of $1 trillion US healthcare spend, admin spend down, depending on who you ask around, 20% of that could be classified as automatable work. So we think fax in particular represents a significant chunk of that, just beyond the actual fax market. The fax market itself is $1 billion market. But then when you think about all the work that's potentially automatable, then you start to see, a much larger market that, may even exceed 10 billion.
You mentioned earlier when we talked that you don't have an active raise. Have you had enough capital to grow as fast as you'd like to grow? Is there a pain point there for yourselves, just as far as being able to go as fast as you want to go?
So we've been really lean and scrappy. We raised a small sort of seed round tail end of 2021, and that's enabled us to get to where we are today. We are on track for profitability without another raise. That being said, I think we are exploring, what some additional capital could look like, whether in a small round toward the end of the year or sort of a larger, more traditional Series A next year. We're quite flexible, just depending on if we have the right opportunity to make some moves.
So if I were to summarize Medsender, and correct me if I'm wrong in any of this, Medsender is a software as a service platform that helps any healthcare organization or EMR automate what would otherwise be mundane tasks to either reduce staff numbers or improve staff productivity.
Yeah, I think that's a great summary. Today, a lot of what we focus on is fax, but we are working to automate additional workflows. We think there's dozens of different workflows that are commonly done in healthcare, especially on the practice side, that AI could really help transform. And so that's what we think is the total opportunity, not just fax. Fax is just the entry point, but then there's so much work downstream that we can help with.
In the world of precision medicine and some of these, 15-page lab reports that you see, as that's a newer offering, is that data being transferred digitally now, or is that coming in through old-fashioned fax, or does it vary?
It really does vary. There are a lot of EMR integrations out there that different platforms have. Like a lot of labs, for example, do have EMR interfaces so that they're able to push data to and from as needed. But at the same time, a lot of these companies are still sending results via fax, and that's something that Medsender has been able to help with. We do work with a handful of lab companies today to help automate and streamline the sharing results process.
We love stuff on Merge Medical that helps patients and helps allied health professionals take care of those patients. So this is a very efficient process that helps any healthcare organization take better care of patients. Like you're referring to the fact that you just won't miss referrals. I mean, a missed referral could cost someone life or limb. And so it's really a win-win for us to have someone on here like you, because this is going to help people financially and clinically and administratively. It's really a win-win-win.
Absolutely. I think in terms of anything else, sort of the only other thing I might add is, we are continuously building out what our product is capable of. While we have achieved while we have achieved a level of product market fit we're pleased by, we think there's enormous opportunity to continue to expand and build out what our AI is capable of doing in terms of extraction, but also what our platform is able to do in terms of the automation, whether that's additional workflows to automate for things like intake and registration, or if there are additional workflows on the practice side. We have a pretty long roadmap of things we'd love to get to. And so if there's any big challenges or pain points that clinicians are facing today, we love to hear about them, because that's how we've built most of the platform today, is from feedback from users like providers and their staff. So anytime we can talk to providers, we're always happy to.
And Salman, that's excellent. I see someone like you, you're young, you're bright. I think you're going to go on to do great things in the world. That does push me to ask one more question. I see that you're laser focused on the healthcare side of this, and that's how we came to meet. But I can also see where what you're doing could be applicable to other industries.
Yeah, we've had companies or folks ask us before, are there any thoughts about working on some other verticals?
Right.
One of the common ones I've heard is in sort of tax or compliance, or the banking industry or insurance, things like that, or even employment, where there's a lot of paperwork. And I mean, the short answer is maybe one day. But for us, we think the challenge in healthcare is enormous. We think there's so many different workflows we could work on. And for us, we think focus is really important. And we already have enough on our plate with healthcare, so we don't want to just get too distracted, as we continue to work and build the best solution out there for a healthcare audience.
That's awesome.
Great answer. I like that answer.
Yeah, that's awesome. One thing I think another area that's ripe for disruption and correction is still the EMRs. They generate so much digital garbage. And the example would be, I can click on, I don't want to badmouth a company, but I can click on a hospital system and click chest x-ray. And it doesn't immediately show me either the x-ray, the picture, or the radiologist read. Instead, it shows me several pages of garbage of who entered this, what, when, by whom, and these just records that are meaningless to the practitioner. And all of the systems do it to varying degrees. And it's not where it needs to be. And I know, Jeff, you saw this just like I did. When we rolled out EMR here in town, doctors quit. A lot of doctors retired early, and it's still not what it needs to be. And we've had EMR here for 10 or 12 years. I trained in Cleveland. We had Epic 20 years ago. And when I got back down here, I used the metaphor that, the cardiology clearance would come on the back of a napkin, patient cleared for surgery, and I've got no echo and I've got no EKG. I don't have the studies. I've just got some cardiologists saying, yeah, they're good. So then when the EMR came out, I thought this was going to be a lot better. I'm sad to say, I don't think it's improved healthcare. I think in some ways it's made it more difficult. The clinic that I worked at before, they use more paper now than they did before they had EMR.
Absolutely.
If you get a bright guy like you get this component, this solved, that's the next step where we actually make EMR what it's supposed to be, to actually improve patient care and communication amongst providers. Well, we sure appreciate you being here, Salman. This has been a fantastic, enlightening interview with you. I've been your host for the Merge Medical podcast, Dr. Jeff Brown with Dr. Jeff Cole. Salman, thanks for joining us. This has been great. Thank you so much.
Thank you both. This has been a pleasure.